great lesson on making our marriages work or making marriages work. This is your host, Dr. Tulipo Mwenfumbo, and we are looking at professional marriage counseling. And we are now looking at module 3, which is sexology. Uh, as I said, this is your host, Dr. Tulipo Mwenfumbo. We are going to look in the subject of sexology as one of the major issues in marriage. Marriage can never be marriage without sex. So, sexology is the most important, is one of the important matters or the most important matter in marriage. So now, what is sexology? Sexology is the scientific study of human sexuality, encompassing various disciplines. So, sexology plays a crucial role in marriage counseling as it addresses sexual concerns, enhances intimacy, and promotes overall relationship well-being. Why sexology is important in marriage counseling? When we look at marriage counseling as marriage counselors, as the people that are working to make marriages work, um, sexology is very important because it addresses sexual dissatisfaction, it enhances intimacy in marriages, it also improves communication, it helps to resolve conflict and matters in marriage, and it promotes emotional intimacy and encourages empathy, also supports sexual health and fosters trust. There are common issues in marriage which has to do um, with sexology or sex in marriage because it is a critical or crucial issue in marriage. And when you look at the strength of marriage or the most of the things that are a challenge in marriage, you discover that they are coming from the issue in the bedroom. You know, many people they want to look at marriages from afar, but most marriages, the challenges and the problem starts from the bedroom, and that's where the issues are raised and the issues has to be tackled. And most of the issues in marriage has to do with sex. For example, if we look at infidelity, infidelity has to do with sex, and faithfulness in marriage, it has to be done with sex. And so when we have to look at the common issues in marriage and why are sexual challenges in marriage. Number one, sexual desires discrepancies. So there are the problems that comes in marriage is when the couple has differences in sexual desires. There are people that are hyper and also there are those that are less hyper in sex. So that can also be a common issue in marriage whereby this one always is tired, this one doesn't want to have sex, and all those things. So those are the challenges, some of the challenges that are found in marriages. So the balancing up of sexual desires in marriage, whereby one has hypersexual desire and another one doesn't have hypersexual desires. Then there is also erectile dysfunction. So the others, there are some challenges or disabilities in sexuality. So some people have got a sort of disability, which we are going to look at later on. So you'd find that the challenges of sexual comes in marriage when one has less performance or cannot be able to perform sexually in marriages. So that brings tension in marriage and also challenges comes about. There is also premature ejaculation. This is mostly happens to men, whereby this man always leaves the wife unsatisfied. So it becomes an issue in marriage, and you'd find that infidelity comes in because the husband is unable to satisfy the wife. There is this issue is mostly common to women. You know, if there is a challenge in sexuality in marriage, it mostly comes from women, because most when the men are saying that no, she doesn't satisfy me, she what, it's layer, and it's just the escape god. But men have got less challenges in marriage, regardless of the person they have married to, unless if she has got some sexual dysfunction. But any woman that has that that functions sexually can be able to satisfy the husband regardless of what kind of sexual styles or what that woman does to the husband. So as long as she shows interest of sex to the husband is able to be satisfied. Unlike the women, there are a lot of challenges when it comes to the satisfaction of women in marriage. So that's why there is this question what most women ask: are women different? Yes, women may be different in actions and in other things, but when it comes to sexual satisfaction, I think a man just needs ejaculation and he is satisfied. So these challenges, the challenge of premature ejaculation, it's common in marriage, and it causes the infidelity when it comes to the women or to the wives. The other thing is difficult achieving orgasm. So this is also a challenge mostly which is common to women, where they are failing to reach orgasm. Even the men, there are men that fails to reach orgasm, whereby he is maybe somehow disturbed in the mind, and he cannot complete his sexual activities, whereby he reaches at orgasm and be able to satisfy himself and to satisfy the partner. Then there are also painful intercourse. There are painful intercourse also, which is also mainly to women, where the women feels pain whenever they are having sex. So that becomes an issue in marriage, and also same like the to the main. Although there is less challenge in this issue of painful intercourse, but there are also some men that have this challenge. Then we have got infidelity, as we said, the challenge of having sexual partners outside marriage. It is also a big issue and a big sexual issue in marriage. Then there is sexual addiction. There are people that are sexually addicted, whereby they cannot stay for a day without having sex. So such becomes an issue in marriage. For example, if such a person goes out, is not at home, you'd find that infidelity comes in. Even in marriage, as we were talking about discrepancies in sexual desires. So that also there are people that are addicted to sex, and they cannot live without sex, and it brings issues in marriage, especially where now there are these rights or in marriages. You know, the challenges that we are having now in marriages when it comes to sex, denying your husband or your wife sex, it is part of GBV. It's part of violence in marriage. And also excessive or demanding sex when your partner is not in a mood of having sex, it is also GBV. So that is where now it has to be balanced up. So when one is addicted sexually, it brings what is called marital challenges or sexual issues in marriage. Then there is gender identity concerns. The other thing, it is whereby the husband or the wife who is uh, who is supposed to take control or to take charge in marriage. So the gender issues comes in whereby even if the woman, maybe she wants sex, since she has been taught that a woman does not demand sex from a husband, that becomes a challenge. So though these are some of the challenges that are faced in marriage. Now, let's talk about sexual types and practices in marriage. On this matter, I think I'm not going to teach, but we are going to look at. I want you to have a research on this matter. So you're going to have the assignment where you're going to look at sexual types and practices. And here I've outlined the practices and the types of sex which you need to do research. There are about 19 of them, and you need to research and understand what these are. Now, what are these? Why should we learn about these type and practices? There are a lot of types and practices, sexual practices in marriages or in this world. So you may find that the challenges of sexual sex in marriage may come from the practice that one partner has. Like there was an issue whereby this person couldn't stay with women, and the only sex that he enjoyed was relishing. So the sexual practice, which is called relishing, it's a practice whereby a woman or a man, or for example, one is eating in shima by relishing from the private part of a partner. This is the husband who wants the wife to be negative, and he's going to be eating in shima and placing the shimmer on the vagina of a wife, and is eating, and that is how he enjoys sex. So there are a lot of abnormal sexual practices. This also happens to women. So now these are the challenges that causes sexual challenges, sexual issues in marriage. So we need to understand the sexual types so that as counselors we'll be able to know how to handle sex. You may find a couple which the husband may be complaining that my wife is not sexually active, yet she has other words or other types of sex that she practices, and the husband doesn't know. So as a marriage counselor, you need to understand these types of practices, sexual practices, which deprives other partners not to be engaged so much in sex. So women and men, they have got some of them, they do these abnormal sexual practices which may the partner may not be aware of. For example, there are those partners maybe who are exhibitionists. They just like to show their nakedness, and that satisfies them sexually. And when it comes to bed issues, they are not willing, and they don't desire. I'll give example of exhibitionists for those people or women that you find that they put on short dresses. Some people, they are preconceived and they think they dress like that because they want to be attracting men. No, some of them, they don't even desire to sleep with any man. They don't. They just They just enjoy when men are looking at them, and they are attracted to the way they are dressing, and that satisfy them. And after that, they even release and find that they have satisfied their sexual desires. Others, they are masturbation addicted. So you find that whenever the husband comes or whenever the wife wants to have sex, this husband or wife will say, I'm tired, or I'm not interested. Why? Because maybe this she practices an abnormal sexual practice, which may be maybe masturbation. So all these practices may create some sexual challenges in marriage. Now, let's look at sexual dysfunction in marriage. Sexual dysfunction refers to difficulties or impairment that affects an individual's or couple's ability to experience satisfaction from sexual activities. Sexual dysfunction in marriage refers to difficulties or impairments that affects a couple's sexual relationship, causing distress and impacting overall relationship of marriage. So you'd find that sexual dysfunction may be able to may uh, challenge, maybe a challenge in marriage, which may lead into a lot of tensions in marriage. And how do we deal with these matters uh, as the male sexual uh, sorry for interruption. Let's continue. And we are looking at sexual dysfunction. So, uh, what are some of the challenges which couples face when it comes to sexual dysfunction? Now, we look at male. Men, they have got these challenges on sexual dysfunction. There is what is called erectile dysfunction. This is the inability to achieve or maintain erection, whereby the husband is unable to maintain the erection. The man cannot stand. A man cannot stand for a long time. So that is a dysfunction. Then there is premature ejaculation, as we said. Which is early ejaculation during sex. Before the woman is even reaches orgasm, a man has already ejaculated. Then there is delayed ejaculation, so difficult in achieving orgasm. There is also this dysfunction whereby a man cannot reach orgasm. He will keep on pushing, pushing. The woman is tired and pushing, and no reaching the orgasm, no time, no releasing. Then there is low libido, decreased sexual desires. This is also a challenge in men, whereby they lose, they have a low sexual desire. To female, there are these dysfunctions: female sexual aroused disorder, difficult in becoming aroused. So there are challenges that women may face, or which may be the dysfunction in marriage, where a woman cannot be aroused sexually. Then also there is also female orgasmic disorder, difficult achieving orgasm. There are women who can take, no matter how much you do, no matter how much strategies you may use to make her reach orgasm, they will not reach. They don't reach at that pressure in sexual activities. So that is also the disability which may bring challenges and problems in marriage. Then there is dyspareunia, which is a painful intercourse. This, as I said, it is more common in women where they are having what is called dyspareunia, which is a painful intercourse. Then there is uh, vaginismus, which is involuntary muscle contractions during sexual intercourse, whereby there are, during sexual, there is those contraction of muscles. Now, this becomes a challenge when they are involuntary muscle contractions. And also in women, there is a low libido, whereby the desire for sex is decreased. Other sexual dysfunctions are sexual desire disorder, low and absent sexual desires. There is also sexual aversion disorder, which is avoidance of sexual activities. And this is also very common, especially when after divorce, uh, where a woman is trying by all means to avoid sexual activity. Like also when she's suspecting the infidelity in marriage, or when there is suspicion of infidelity in marriage, there is sexual aversion disorder, whereby they begin to avoid sexual activities for each other. Then there is orgasmic disorder, difficult achieving orgasm. Then there is genital or pelvic pain, penetration disorder, painful intercourse. Now, what are the causes of dysfunctions? There are different causes of dysfunction, sexual dysfunction. Some of them may be psychological, it may be physical, it may be biological, it may be, there are different challenges that causes sexual dysfunction. So let's look at psychological factors. Psychological factors that may cause sexual dysfunction may be stress, anxiety, and depression. So stress may bring low interest in sex, or it may make the partners not to have the desire for sex. Then anxiety, whereby worries, if one is worried about things and there are challenges that one is afraid of something, it also may cause low performance or dysfunction in sexual activities in marriage. And also depression. Depression is also one of the reasons why in psychology of sex, which causes sexual dysfunction. Then there are medical conditions that creates also dysfunction in sex, like diabetes, heart disease, cancer. So this also brings challenges. Diabetes would cause the low or dysfunction, sexual dysfunction in marriage. Maybe your husband or your wife was doing well sexually, but after having this medical condition, they begin to have the challenges. Then there is medications. There is antidepressants. The antidepressants are those medicines uh, that are used for depression, and also like Valium and other medicine, blood pressure medicine. So these may cause what is called, they may cause dysfunction. So the medicines, there are different medicines that may have effects on your sexual desires, and it may cause sexual dysfunction. Then the other thing that causes sexual dysfunction is hormonal imbalances, whereby the hormones are not balancing, and the hormones have there are dysfunctions in the hormonal challenges in the body. They may cause what is called sexual dysfunction, and it may create some challenges in marriage or in sexual satisfaction. The other thing that may cause sexual dysfunction is relationship issues. When you have the issues in relationship whereby you have been, as I said, maybe you have suspecting of marital infidelity and other things. So one may just lose sexual desires, whereby if one is not happy about the sexual behavior of the husband or the wife, it may also cost and create some challenges. The other thing is trauma or abuse. When one is being abused either by the husband or by the wife, they may lose their sexual desires. So this may cause the one to lose sexual desires because he feels or he is being abused by the partner. Then the last thing that also causes sexual dysfunction, it is aging. As we get old, as get old, there is also the dysfunction that comes in when it comes to marriage, to sexual. So the desire for sex goes down as people ages. So like this mostly happens when you have married a young person. You are married to a young person or you have married a young person. The husband is turning 60, the wife is 40. So the husband's sexual desires decreases, and the wife, that is when she's on hyper. So that also brings the challenge in marriages. And same like whereby the wife goal is above 50 years, their sexual desires goes down, and it may they become less functional sexually. So these are the challenges and the causes of sexual dysfunction. How they affect in marriage. So sex sexual dysfunction affects marriages by emotional distress. Sex, it's a feeling. So any feeling that is not attended to, it comes out in another feeling. So it may cause some anger, some moods, and all that. So when there is no proper sex in marriage, it may cause a lot of tension. Also in a relationship, tension. It may decrease intimacy. It may bring conflict and feelings of guilty and shame. You can imagine you don't have sexual feelings and your partner wants to have sex with you, and you cannot give the partner what he or she deserves. So that may cause conflict, and also it may cause guiltness to yourself, or it may even bring shame to yourself. You feel ashamed to your partner. You feel you are unable to perform your marital duties. Signs of sexual dysfunction. These are the signs that in sexual dysfunction. Avoiding sex. So people, when they are a challenge in some sexual disability or impairment, they intend to avoid sex. Difficulty initiating or maintaining sex. So they don't initiate when the husband or the wife doesn't demand for sex. It's to them it is Christmas. They enjoy that. They desire that. Then they are not uh, put into a sexual mood. Then pain and discomfort during sex. Then lack of pleasure or satisfaction. So there is, because on pain and discomfort, that is whereby when one is forced into sex, they may not be ready. As a result, that lubricant that comes in when it comes to sex in preparation for you for penetration and all that doesn't come out. Hence, they experience dry sex and it may cause pain. And it's lack of pressure. Uh, you stop enjoying sex. They don't enjoy sex. Decreased in frequency of sex. So these are the challenges. So how can these challenges be treated? Number one, there is counseling. uh, as we said, the other challenges of marriage, of sexual dysfunction, it is those that assignment that we have some sexual practices. Uh, so they need, if the couple is, as a counselor, you need to assess the couple, what could be the cause of sexual dysfunction in marriage, or what are the challenges they are having sexually. So you may help them through counseling. And when you see it's has to do with health challenge or medical challenge, you have to refer them to the medical professional. Same like if it's a hormonal challenge, you have to refer them to the medical practitioners. Then lifestyle changes. So as we said that if it is caused by stress and other psychological matters, it is your duty as a marriage counselor to bring to rest these challenges that may cause less or dysfunction in sexual activities in that couple. Then sex education and coaching. Um, the other thing is that as a couple, you need to understand the art of sex. So we will have to. I wish we can have this one as a separate topic where we talk about the sexual coaching, how one can be able to satisfy the partner sexually, because mostly people want to be selfish in sex. They are just looking at their satisfaction, but they are not considering the other party. But in this, we will have to look at how you can be able to satisfy the other party sexually. So we are going to have, thank you so much and God bless you. Now, before we end, I want us to look at the assignment that we are going to have, which is a case study. And this is the assignment that we are going to have. And the question is that describe your counseling intervention plan. Tom is 40 and Sarah is 38, married for 10 years with 2 children. The couple decreases sexual desires and frequency, leading to relationship tension. Tom experiences stress from work and feels disconnected from Sarah. Sarah feels overwhelmed with parenting and household responsibilities. They report their layer intimate interactions and emotion to you as a counselor. So now, how will you take your counseling intervention? So I want you to set up a counseling intervention, how you are going to help this couple come to terms when it comes to matters of sex. Thanks very much, and God bless you. This is your host, Dr. Tulipo Mwenfumbo. Meet you in the next lesson where we are going to look at conflict, marriage conflict, and divorce. Thank you so much, and God bless you once again.